Hello, and welcome to the Bellaire Family Eye Care and Contact Lens Institute Scleral Lens tutorial. Over the next few minutes, we will guide you through what we feel are the best practices for scleral lens insertion and removal. First and foremost, before handling a contact lens of any kind, it is imperative that you thoroughly wash your hands with a mild, non-moisturizing soap and then dry your hands with a lint-free cloth or paper towel. Before inserting your scleral lens, be sure to hold it up to a light and inspect it for chips or deposits. There are several methods you can use to properly insert a scleral lens, but we will cover the two most common in this video. The first method involves utilizing a large scleral plunger. Gently squeeze the plunger to create suction and then place the lens in the center of the plunger. Release your squeeze once the lens is positioned and suction to the plunger. Fill the bowl of the lens completely with preservative-free saline solution to avoid an air bubble. Looking straight down at the center of the plunger, hold your eyelids open with your non-dominant hand. Lid control and proper fixation is crucial. Move the plunger toward the center of your eye. You will feel the fluid in the lens first, but keep moving the plunger towards your eye until you feel the actual lens. When you feel the lens touch your eye, lightly squeeze the plunger to release the lens. Blink a few times to help the lens find the correct position on your eye. Then repeat this process for your other eye. The second method is called the tripod method. Create a tripod with your thumb, index, and middle finger of your dominant hand. Place the lens in the middle of your tripod. Many patients prefer this method because it feels more natural. Fill the bowl of the lens completely with a preservative-free saline. Filling the bowl completely will help to prevent an air bubble. Looking straight down at the center of your tripod or the lens, hold your eyelids open with your non-dominant hand. Lid control and proper fixation is crucial. Move the lens towards the center of your eye. When you feel the solution against your eye, gently press the lens to your eye and let go of the lens and your eyelids. The lens will adhere to your eye. Release your lens and blink several times to help the lens find the correct position on your eye. Repeat this process for your other eye. There are also two methods to remove a scleral lens. Applying 1 to 2 drops of saline or an artificial tear to the eye before removal will loosen the lens. The first method is using a small plunger. Check to see where the lens is located on your eye, and then look straight ahead. With your non-dominant hand, secure your upper and lower eyelids. Wet the tip of the small plunger with saline. Using your dominant hand, place the plunger on the bottom third of the lens, and then pull the plunger up and out. The second method does not involve using a plunger and requires you to break the suction of the lens to your eye. Look straight into a mirror. Using your index finger, press your lower eyelid into your eye below the lens to break the suction between the lens and your eye. When the suction is broken, you will notice an air bubble under the lens. Pull your lower eyelid down until you can clearly see the lower edge of your lens, and then use your fingers to gently remove the lens from your eye. Now let's discuss how to properly clean your lens. Gently rub your lens with multi-purpose solution and rinse with saline, never tap water. Fill a clean case with solution and leave in the case overnight. Remember to clean your case weekly with warm soapy water and allow it to air dry. And also replace your solution daily. The lenses may be applied to the eye after removing from the case. Rinsing with saline is optional, but not necessary. Alternatively, we may recommend a peroxide-based cleaner. Open the chamber and place the right lens on the blue side and gently close, and the left lens on the white side and gently close. Fill the chamber up to the line with the peroxide solution and close the chamber. You will almost immediately start seeing bubbles. A chemical reaction is taking place in turning the peroxide into water. This whole process takes 6 hours, so the lenses cannot be removed from the case and/or worn prior to this. After the 6 hours, pour out the solution and allow the chamber to air dry. You may now put the lenses into your eye. Rinsing with saline is optional, but not necessary.